Okay, alright. Add it up.
Hello and welcome to In the Community. I'm Joe Dexter as we talk the COVID-19 pandemic and its local impact here in Rockingham County. Coming up in just a bit, we'll speak with Dr. Steve Luking of Reidsville as well as Susie C. Spear, the RockinghamNow managing editor, about this pandemic and its impact locally. Many of the thought is that this pandemic is gone away just by the simple fact that a vaccination is on the way, but that's truly not the case. We'll talk about the touching stories as well as the impact on healthcare, as well as the impact on us as a whole community. Coming up in just a bit with our great guest on In the Community, but first, let's take a look at the numbers. COVID-19 has surely had an impact here locally, with numbers released Thursday by the Rockingham County Health Department. 3,841 lab-confirmed cases since the start of this pandemic. Currently, 46 are hospitalized, with 46 deaths here in our community. 1,590 have recovered from COVID-19, as we know, with not knowing what is held in the future health-wise for those that suffer from COVID-19. It's hard to say the word recovered, but that's the words used by the local health department. As mentioned, 46 deaths here locally. Home and recovering 2,158 of the 3,795 active cases and 46 deaths here in Rockingham. 2,176 are 40 and over. 1,562 are 39 years of age and under. Total positive cases by week continue to climb over the last couple weeks, as do deaths simultaneously. As you can see on the graphic above, a steep incline in cases here in Rockingham County over the last few weeks, dating back to Thanksgiving and heading into the Christmas season. As we take a look at the breakdown of numbers statewide, 451,874 total cases, with 2,811 currently hospitalized, 5,979 deaths across the state since the start of this COVID-19 pandemic, a 12.5% daily percentage positive rate. That's a closer look at the numbers at the state and local level. This is In the Community. We now welcome in our guest. Susie C. Spear is with RockinghamNow. She's the managing editor. And we also have Dr. Steve Luking with us here. Doctor, we'll start with you. What has the impact been from the doctor's perspective throughout this whole process?
Well, speaking to the immediate situation, I'm extremely concerned by what we're seeing. Every day I'm interacting with 6, 8, 10 people, either not yet diagnosed or actively diagnosed, having challenges with their COVID-19. Every couple of days or so, I'm sending someone on towards a hospital for further assessment. Every few days, one of our patients are being hospitalized. We've seen a definite surge in the communities, a lot more patients with it. It's quite concerning, the direction we're going in right now.
Susie, some of your reporting has shown the numbers increasing as well throughout this recent impact, this recent period.
Yes, I find it really startling that we've seen 531 new cases in 13 days. So our county has seen, we're looking at a 17% rate hike in just 2 weeks. And that's really, it's just, it's shocking to me that our community is not finding the discipline to stem this threat. And I'd like to ask Dr. Luking, what in the world, from your perspective, can you and other healthcare professionals say to citizens now to convince them to act responsibly and carefully?
Yeah, so I've thought about that a bit. I was going to write another piece regarding the vaccine, but the more I thought about it, the real impact of the vaccine is literally still months away. And right now, our community is in deep trouble. For the last couple of weeks, our percent positivity has run in the 10% plus range. The state as a whole is at 12.5%. This means there's a high likelihood that you're bumping into folks who likely have the virus and are not even aware of it. And that really concerns me when we look at vulnerable folks being exposed. We're already seeing clusters of families who became sick right around Thanksgiving. Some families that meant well, that kind of did part activities in terms of being tested the day or so before Thanksgiving and feeling that gave them all a green light together. That does not do that unless you've sequestered yourself somewhere in a room for 14 days. So a lot of folks are mistakenly thinking they're protecting themselves in that fashion. Everybody needs to mask up. Everybody needs to maintain their distances. Like I said in a recent piece, we all love Thanksgiving and Christmas get-togethers, but this year it has to be something absolutely different so that we can continue to have get-togethers in years ahead with particularly our more older and vulnerable loved ones.
What has been the feeling for you to explain to those? Because there is a feeling in the community, well, there's only a 1% deceased rate. It's not that serious. It's like the flu. What is your message to folks that have that belief when it just comes to simply, this is editorializing for me, simply all it takes is putting a piece of cloth over your face to help?
I think one data that I read recently is that in the last 11 months, we've had more Americans die from COVID-19 than Americans have died from the flu for the last 30 years put together. And I'll still bump into people who kind of shrug and say, it's no big deal. They're sorely mistaken. They're relying on erroneous news sources or places of information. Masks are extremely effective. Masking of both parties are extremely effective. If you go in a place of business and that person is going against the state mandate and they're not wearing a mask, I'd turn around and not provide them any business. It depends on how much time we get. I do my best to stay out of structures pretty much, except for this medical office and my own sequestered off spot in my house. I'm staying out of structures. I absolutely am not going out to eat anywhere. I think that's a high risk behavior currently with the prevalence of the virus in the community.
Dr. Luking, one of the things that has really struck me, national reporting and public health professionals citing the high incidence of long-term side effects, even in patients who have had so-called mild COVID symptoms. Do you feel like our community is aware enough of the threat of long-term side effects?
Jury is somewhat still out there in that we really haven't found ourselves into the long-term space yet. I am concerned about the studies I've been reading that show potential evidence of long-term damage of heart, lungs, nervous system to some who've experienced the disease. I have a youngish lady who's a very good walking example of that. She suffered myocarditis from the virus back in the summer, and her ultrasound pictures of her heart strength shows that it's still operating as if she were an 80-year-old person who's had a couple, 3 heart attacks. And I just find that devastating, and it's a permanent life-changing event for her. Having said that, I have bumped into enough folks with this earlier in the year who really seemingly are back to 100% to say that, thank goodness, a substantial portion of folks who experience it do not end up with long-term sequelae, as they call them, but I surely would not risk it.
What are some of the direct impacts that the hospitals and the services like you are providing are feeling from COVID-19, even at this point in time?
Sure. So we've tried to keep our facility, our medical office, fairly free with folks with active disease. That's put some constraints both on our challenges providing good attentive service and also challenges on our patients. If we have someone actively sick with respiratory illness, we try to interact with them just like we're doing here with the computer. 95% of diagnosis in medicine is history anyway. You don't need to necessarily put your fingers on every single patient to know what's going on. So I'm fairly feeling good about the fact that probably high 90% of folks we see we're able to manage and take care of, get the proper testing done through the testing centers without having to burden the emergency room or elsewhere to send them. We definitively take care of them. An occasional person slips through with very nonspecific symptoms, and we're seeing them, and as the visit progresses, we're aware they're sharing symptoms or signs consistent, and we have had folks where we subsequently test them and they test positive. Hence why I mask up and wear lots of stuff when I go into the rooms with patients, because you can't be 100% sure. On a more regional basis, I'm very, very concerned about hospitalization rates. You showed the Rockingham County piece earlier on. It showed 46 hospitalized. If you had looked at that same piece 10 days ago, there were 18 hospitalized here in the county. Very concerning. September, we had 30 some hospitalized in the cone system. As of last Monday, there was 140 some. The last I heard, or Monday 2 weeks ago, the last I heard is it's over 200. I don't have the exact numbers because they haven't put them out in the last couple of 3 days. Practically speaking, Annie Penn, for instance, at Annie Penn Hospital here locally, has been able to maintain their inpatient status free of patients with COVID-19. Now that the COVID-19 hospital is full, we are having to admit patients here under controlled circumstances and negative airflow rooms using all the proper precautions, so still relatively safely. But the last I heard, there were 10 in-house patients here, whereas just a few weeks ago we had 0. So that adds new realities and new challenges to the local community hospital trying to deliver the goods.
What impact does that have on a small rural hospital that people might not understand?
Well, so not only are folks coming down with COVID-19 now, but they're coming down with many other things. Flare of congestive heart failure, acute appendicitis, all kinds of issues that need the intervention of a good community hospital. Our county is fortunate enough to have 2 of them here. My understanding in recent weeks, there's been times where the Rockingham Hospital in Eden has had to close itself to new patients just because it's overwhelmed with all the matters at hand, both COVID and non-COVID patients.
And I understand that a good number of staff have become ill from time to time at UNC Healthcare, at least I think in the last week or so. One of the things that I've been very curious about is, are you seeing reluctance in patients, Dr. Luking, reluctance in individuals to come forward with symptoms? And as you had told me perhaps a month ago, reluctance by some diagnosed patients to share their diagnosis with family, friends, and coworkers.
Yes, in part due to the many different opinions on this disease process itself. We've seen that across the board, and it takes on all kinds of appearances. I've had folks who are very reluctant to declare themselves sick because they have no sick pay, and they've noticed others at their industrial workplace continuing to work despite sniffles and occasional cough. And even though I think they likely have it, they're reluctant to go get testing and reluctant to tell their workplace. I've had others, I recall an interaction earlier in the year where I walked in a room and a certain patient had their mask off and was kind of laughing and joking about it. And I moved him to another room immediately, considering that first room potentially contaminated. And I wasn't totally happy and asked them, to consider other patients that are going to be in the room later in the day. And sure enough, a number of weeks later, that person happened to bump into the virus. So there are lots of hesitancies and reluctances, and some based on all kinds of reasons. But it's too bad, because we have a virus that basically is a community-wide burden, and you can't separate off the believers and the non-believers, and those following the rules and those not following the rules. We're all in this together, so to speak. And when a group becomes casual or stays casual, it harms everyone.
Imagine some of the individuals who are reluctant are struggling financially in extreme ways sometimes, adding to the problem.
That's exactly right. I have a chunk of patients who don't have insurance. North Carolina is one of the states, unfortunately, has decided not to expand Medicaid. And that's tremendously ironic to me. I have a lot of essential workers on the front lines getting sick who aren't insured or are reluctant to contact me and reluctant to, have to pay more medical bills. And it's a crying shame. Another challenge with this pandemic.
Before you guys head out of here, I want to ask both of you, what are some of the personal stories that you have been a part of and have seen, and just some of the increasing numbers that you've seen over the last few weeks that have impacted you in your professions? And we'll start with you, Susie.
I have just been really, really impressed and saddened by waking up every morning to check the statistics and to report on new deaths, and seeing just such extreme climbs. I'll let you know, we've had 275 new cases since last Friday alone, 4 deaths since Friday in Rockingham County. Over the last 13, 14 days, we've had 9 additional deaths. Another thing that is on my mind is our county's ability, as the vaccine rolls out, our county's ability to see that individuals who are given the first of 2 inoculations actually come back for the second. So I am interested in a lot of the administrative issues that are yet to come and how our county plans to solve that. I'm heartened by the fact that we have a new public health director. I also want to salute Susan Young for her excellent job as interim public health director. I feel like Mr. Wright will have expertise in helping organize the follow through with vaccination campaigns. I hope so.
So a couple issues that Susie brought up there to speak to real quickly. This vaccine is extremely effective and I think extremely safe. When you compare the disease process to minimal reactions for the vast majority and a rare allergy reaction for a very few, this vaccine is going to really help get us on the other side of this. It will be something of a challenging rollout. There's a lot of details. Perhaps, Joe, you can devote a whole show to that relatively soon, but I'm a big fan. On a more personal note, as I too read the North Carolina and Rockingham data every day, and sometimes as I see one death added, I think, about our patients who are sometimes on that list. I think going forward here in the short term, the most crucial thing, I'm getting so many families that are just surprised. They've, quote, done all the right things. But when I really get to diving in, they're not doing all the right things to the T. This virus is a sneaky bugger. And all it takes for you is to drop your guard just one moment, and it's going to bite you on the backside. If you're young and relatively healthy, you'll likely get through it okay. But if you get it, you might carry it on up the generational divide to someone you dearly love who may do very not okay.
He's Dr. Steve Luking. She's Susie C. Spear, Dr. Luking of Reidsville, and Susie Spear here with Rockingham Now, our local newspaper, the managing editor there. Guys, I want to both thank you for the time today on In the Community, for stopping by and sharing with our community the impact of COVID-19.
Thank you.
Thanks for having us.
You can find out more about In the Community by visiting facebook.com/Dexter Media Solutions, where we help you tell your story and tell the stories of our community that need to be telling. Have a great day, everybody. This is In the Community.
Okay, all right.